I am Robert McMullen. I'm a psychiatrist with TMS Brain Care in New York City. You know, I think there's been some major steps in psychiatry in my lifetime. And maybe one of the biggest revolutions has been TMS coming in, which can bring 30% or more of the patients all the way to euthymia in 6 weeks. This is just such a revolution. And I think that the recent FDA approval of theta burst is going to be another big step, because this is going to allow us to treat many more people. So to explain a little bit about theta burst stimulation, we call it TBS for short, is that it was found in rat hippocampal cells that they were communicating in this particular pulse pattern. And what it is there's 5 bursts per second. But each burst is a burst of 3 normal pulses, so that you get a total of 15 pulses per second. And when you do an excitatory treatment on the left dorsolateral prefrontal cortex, which is the standard treatment for depression, these pulses run for a couple of seconds, and then there's a little intertrain interval. But you do just a total of 600 pulses in just over 3 minutes, and you've done the whole excitatory treatment here. Whereas normally, we've done 10 hertz per second, and usually do 40 pulses, have an intertrain interval of 10 or 15 seconds, and that whole treatment on the left side takes at least half an hour. So this is quite a difference to be able to just have the treatment done, and the patient, from the time they walk in the room, get in the chair, get the treatment, it's all done in less than 15 minutes. One of the reasons that there is an intertrain interval for the standard excitatory treatment is for the coil to cool down. If you did it 20 pulses per second for 2 seconds and just had a 3-second interval, the coil will overheat. But we've never had a problem with the theta burst. We can do those 600 pulses and it doesn't overheat, and then the coil has, you know, at least 10 or 15 minutes to cool off before the next patient. So it's not, there's never been an overheating problem. It certainly makes it much more affordable to treat a lot more people more effectively, and more convenient for them too. They can come in, sit down for 15 minutes and go off to work. It's a lot different than having to sit down for a whole hour. In fact, we were doing 10 or 11 patients with our MagVenture machine the last few days. And if we didn't have this theta burst, we couldn't easily do what we've been doing.